some steps as we go along. So I'm going to tell you two stories first. I'm going to try to call it the story of a lady because I can't use her name. In July of 2015, she was diagnosed with cancer. She had both breasts removed. Followed up with chemotherapy and radiation. Declared healed in August of 2015. Hip pain started in September, full of arthritis. Very painful cortisone shots, which debilitated her with no improvement. In November, she was told she had cancer in the bone. And was given the option to do radiation to reduce the pain some, because the cancer was now spread through her complete body. She was then told by her medical doctor at the end of November to please leave my office. There's nothing I can do for you. Go home and die. She came into my office in December. Basically, they destroyed her immune system. They destroyed her whole system. She was dead when she walked in the door. We helped her feel better. We had her family at the office together for her last time together, and she passed in January. She was killed by the system. The next patient we talk about is an arthritis patient. Given low-level chemo for 13 years for arthritis, rheumatoid arthritis. Yes, it's a standard treatment for arthritis. Quote standard, whose standard you're listening to. Continued to get worse, losing most use of her hands, degenerative knees, degenerative hips. Her hands were like this. She was told by her MD that he could not help her and leave the office when she asked, is there alternative care I could do since you can't help me? He literally got angry with her and sent her out the door. They did some research on this doctor, and this doctor happened to sit on a pharmaceutical company board. Why do these things happen? And I'm going to talk about what's called standard of care. And I think you all need to understand this, which was said previously. If I have a group of you at this table and you're all medical doctors, or naturopaths, or chiropractors, doesn't matter, and you have a patient come in with a certain symptom, let's talk about, we're a group of MDs, and you're sitting here, and a patient comes into you with high cholesterol. Standard of care says you have to be on a statin drug. Now, if the doctor does not offer you and force you to go on the statin drugs, the other rest of you at the table can complain to the board and you will lose your license for not doing the standard of care. So you find with chemotherapy and cancer is the same thing. There is nobody can treat cancer in this country except board-certified cancer treatment centers. If you treat cancer and you're not certified by that, you are outside your standard of care and you'll be prosecuted and lose your license as a general medical doctor. You can treat their immune system, but you cannot treat the cancer. But I will tell you that also in respect that your cancer rate survival with chemotherapy in 5 years is less than 3%. That number has not changed in the last 17 years. What's driving this? The drug companies, pharmaceuticals. You talk about where it's coming from. The government plays along, but it's being run so heavily by the pharmaceuticals, it's ridiculous. There are 4 lobbyists for every senator back in Congress now. 4. That's a lot of money if you add up the numbers of that. Money for the vaccinations and chemo. A doctor will be reimbursed $44,000 if you get all the vaccinations for your children. It's given to you by the Cross. I think it's 29 is what it is now. Radiation, chemotherapy is reimbursed back to the referring physician on chemotherapy. So if you come in with cancer, they will push you for chemotherapy immediately. The reason is that it's reimbursed back to them and paid back a bonus on referring patients to them. Now that was supposed to be illegal to get referrals like that, but they bypassed the laws on making that a different name of what they call it, the money referred back on. So realize those things are existing right now. So where's it come from? Now it's interesting, I've been preaching this, again, you've been 12, 14 years. I've been 40 years watching this merry-go-round. And I've watched it, seen it, preached it, hollered at people about it, yell up and down, and nobody seems to want to listen very well. So I admire this group getting together and coming together in this venue now. The question now is, how do we go forward, where do we go forward? So we're going to take it back right home to the state here, because that's really important. What we can affect right now is you literally can reach next door and touch your neighbor. You have the ability at this table right now to touch your neighbor, don't you? And you have the ability to touch your legislator right here because they live in your city block. That's where you're going to make a difference. I'm explaining to you what you're going to do this year. I'm going to do 2 things this year. They're very simple, very easy, and I'm going to show you why it makes an impact here. So, at this point in time, our state is being run by the IMA and the pharmaceutical companies in this state. Evidence came across real clearly. I asked if there's any legislators here. There are 3 MDs I know in the state legislature now. Have you ever checked where they get their money for their election campaigns? If you do, you'll find over 50% or more of their money comes from the pharmaceutical companies and the IMA. You ask why our chiropractic board has been under fire, and the HFI board has been under fire. Where do you think that comes from? The IMA. I've been heavily involved in the politics of the state since 1982. And I've watched this happen and happen and happen. And what we found is this funding goes through, and the legislatures rely on the medical doctors because they think they're more knowledgeable about what happens. Unfortunately, they have a vested interest in what their knowledge base brings to the table. So their opinion is already preset by the pharmaceuticals and the IMA. So keep that in mind as we go through the rest of this process. So what's happened in the state on the local level with that is we found 3 major things I see about, well, 4 if you count some of the law changes. There is everything from taking all of the nutritional products off the shelves in the state of Idaho, and there are actual legislative things that put in play the last 6 years that give enforcement powers to like 4 different agencies that can potentially, if it comes down to a ruling, all the nutritional products will be taken off the shelf and put behind the counter by the pharmaceutical companies. Compounding pharmacies. Now people hear that and think it's a pharmacy gives drugs. No. Compounding pharmacies make nutritional products. High-dose vitamin C, B vitamins, B12, protein, all things that are natural substances that are used by alternative doctors for care. Those items have been dramatically shut down by the federal government, FDA, giving advice to the state rules and laws, pharmacy board, to act in the state to put rules and laws on the compounding pharmacies to make it where that stuff that used to cost $5 now costs $140. So if you want high-dose vitamin C, where we used to be able to buy it for $5 for 30 cc's, it could be up to $140 for 30 cc's. So now all of a sudden, alternative care, which was cost-effective, the price has been driven up so high, it's very difficult for the average person to go in and get alternative care. So with that said, those prices have been driven up by the FDA to drive the compounding pharmacies out of business, so that we can no longer get the alternative care products to treat you alternatively, so you're stuck within a mainstream market of going into mainstream care. Just a short example, high-dose vitamin C, for instance, has 65% better odds of treating breast cancer than chemotherapy. And that's the 5-year survival rates. One thing I'm going to say is a little example we've seen. Knee surgeries and replacements. How many of you had knee replacements in here? Okay, 2. What's it cost you for your knee replacement? $50,000 or $70,000. Do you know? You don't even know what it costs you. The average cost is between $65,000 to $75,000 for a knee replacement. I can guarantee you I can take 100 knees that are close to being replaced, which would be about $7.5 million, and I can do them treat them for under $100,000. I can save $3.5 million just by knee replacements with alternative care. People say, well, insurance companies would love that. No, they don't like that. They want the premiums as high as possible so the shareholders make more money. So keep that in mind. That's not where the answer is. The answer is coming back and pulling our cars back to Idaho. How do we do that? You are roughly 500 people here. If you each contact 5 people, that's 2,500 people. When you call a legislature, it counts as 150 emails every time you call locally. So basically, you would generate 25,000 emails just by your group here. That will affect every legislator in the state here, I guarantee you. So the first thing you're going to require you to do, I'm not asking you to do it, I'm telling you need to do this, is know your 2 representatives and your senator in your district. If you don't know personally, take them to lunch. If you don't, call them, say, I'm actively involved in Idaho Freedom Foundation, I want to see health freedom happen here. So, what do we want? There's one act that we want. We want an Alternative Care Act in the state. We want medical doctors, naturopaths, chiropractors to be able to treat with alternative care products and ideas, because that will then become a standard to be able to use alternative care. Because right now, a medical doctor cannot do alternative care in the state of Idaho. The board will take his license. That needs to be opened up where they're not restricted on the alternative care products they can do. Also, you need to support the chiropractic bills coming around to re-put back what we've had for 50 years to be able to do. We've been able to do IVs and injections for 50 years, and the legislature, which mainly the IMA, took that away from us this last year. Yep. That needs to be changed. You need to tell the legislators, please support the chiropractic bill with a due pass recommendation. You also want the naturopathic bill passed in its entirety to a full scope of practice. Because right now it's being pared down dramatically, and I doubt it'll see the light of day in a very positive form. And I know I'm not being positive on that, I'd like to be more positive, but I've been actively involved in that for years. So those are the things I suggest we do. And we want a complete scope of practice that's not dictated by IMA. So we want a scope of practice of truly doing alternative care. You deserve that, it's your right. And I hope with this organization we'll be able to make this happen. And I have 1 minute. And I would say thank you very much for coming. And just so you know what my other credentials are, I won the Idaho State Elk Fielding Championship in 2008.